computer. Making a description. Okay, I'm putting it on Facebook, so just bear with me.
Mhm.
Uh, okay, I think I should connect it. Preparing, this is preparing for the live stream, so just have patience. And we will start our program pretty soon. Okay, it's been redirected. Connected, preparing, this is preparing for the, okay, it's been redirected. Okay. Preparing, this is preparing for the, okay, it's been redirected. Okay. Preparing, this is preparing for the, okay, it's been redirected. Oh, should I give it or? Preparing for the, okay, it's been redirected. Oh, I don't think I should use this. No, I'm not using this. I'm going back to the, okay, I'm going back to this.
Good
meeting
idea, Rita.
will be live streamed. Got it. Okay, good. Okay.
And I just finished signing all the contracts it asked me to sign, Rita, just now on the screen.
Oh,
Saying
sure.
we're recording it, and also a second one that said it was streaming live on Facebook. So I gave my permission to have that happen.
Okay. So let's record it. Record. It's also okay. Sorry about these technical glitches. I think we have straightened out everything. Thank you. Welcome our audience. And welcome. We are re-recording this side event, which originally was recorded during the side event presented 55th session of Commission on Population and Development side event. Title was, and still is, Global Science and Technology Cooperation, Our Initiatives. Welcome. Join us to advance the causes of peace, health, literacy, and development. Join us to plan, promote, publish, and partner with our initiatives and projects. We plan development together. Women's Health and Education Center has a unique role to play in strengthening the health and education systems in rich and poor countries alike. Technology and innovations in learning are creating new opportunities to accelerate progress towards health for all and education for all. Let us not leave anybody behind. Established in 2001 in USA, WHEC undertakes with the United Nations, UN, and World Health Organizations and UNESCO to achieve its mission and goals. Our e-learning platform, http://www.womenshealthsection.com, which was launched on 24th October 2002 in collaboration with the United Nations, is serving in 227 countries and territories. It is available in 6 languages of the UN: English, French, Spanish, Russian, Chinese, and Arabic. It welcomes universities, teaching hospitals, libraries, NGOs with ECOSOC and or with the Department of Public Information of the United Nations, international organizations, and the academic and research institutions from all over the world for various types of collaboration and various types of accesses to this platform. Join the movement. WHEC Global Health Line is technically an internet application of WHEC in the United States of America, an internet-facing collaboration platform based on mutual benefit and mutual respect, approved and hosted by WHEC in USA. Online learning and e-health has improved role to play to make quality education and healthcare available, affordable, and accessible in every country. Education and healthcare are intertwined. They together serve as the foundation for a better health. Join us to achieve worldwide literacy and access to quality healthcare in every country. The objectives of today's side events are to elaborate strategies that will strengthen national policies in education and health, to share the experiences of experts in improving the accessibility of health services and education, and how best to implement best practices in health and education. Inclusion of girls, women, and minorities in literacy program and support economic growth and opportunities. Number 4, end child marriages. The silence on the plight of child brides must end. Number 5, improving access for girls, women, and minorities to STEM, STEMM, science, technology, engineering, mathematics, and medicine programs. Today, in 2022, there are nearly 70 million brides worldwide. Every 2 seconds, a young girl is forced into marriage. Let us be part of the generation that changes that. The next generation of development programs must make ending child marriage a priority. Moving forward, there must also be more investment in documentation and evaluation of what works to end child marriage. A body of work of successful programs to expand on. Much more work is required across the geographic settings and communities. It is critical that these efforts do not overlook girls who are already married at a very young age. They are among the marginalized members of society and need special attention in development programs and planning. No one lives in healthcare systems. We all live in our homes with our families and with our communities. If we consider what it takes to create health, the school becomes an ideal setting for action. It is indeed an honor and pleasure to launch health promoting school initiatives with our partners and Department of Maternal and Child Newborn Health at WHO headquarters. Schools are helping young women acquire the basic skills, including decision-making, problem-solving, critical thinking, communication, self-assessment, and coping strategies. Learning Life Lesson series, planned and developed and published by Women's Health and Education Center, has special focus on prevention of teen pregnancies and prevention of sexually transmitted diseases. Each new generation of children faces health challenges, but those being dealt with by today's youth seem particularly daunting. Too many teenagers become parents either by they cannot envision another positive future or to their lives or because uh, they lack concrete educational and employment goals and opportunities that would convince them to delay parenthood. No single or simple approach has successfully reduced the teen pregnancy rate. Much more study and efforts are required. Our projects programs will help schools and universities to plan and develop health promoting schools, programs for youth development, mental health programs to prevent gender and gun violence, how to handle life challenges for good mental health. We welcome everyone. Please share with us your experiences, your projects, and your programs. Gender equality, including in education and health, is a condition for development. The connection between education, health, and earning capacity is better understood. Ensuring that our surroundings are conducive to good health means directing efforts at all levels within and between all sectors of civil society. We can make healthier choices and lay the foundation for true social and economic development. The healthy future of society depends on the health of today's children and their mothers who are the guardians of our future. Because all 17 sustainable developmental goals are inseparably linked, they must be achieved concurrently. Poverty impairs learning, health, and development. The low social status and literacy of women in some countries limit their access to economic resources and healthcare education information. This in turn limits their ability to make decisions about their health and nutrition. Some women are denied access to care either because of cultural practices such as seclusion or because decision making is the responsibility of other family members. Lack of access to and use of essential obstetric services is a crucial factor that contributes to high maternal mortality. Skilled attendance means successful outcomes. A focus on maternal and newborn health, including psychosocial support, should be the center of policy and action. A strong and vital health force is an investment in education and health sectors for today and the future. Internet classrooms have potential to manage knowledge flows easily and is readily available, thus reducing the chasm between what is known and what is done in education and in health sectors, so-called no-do gap. These projects and programs strengthen and reflect sustained high-level political involvement and can support the scale-up of programs within and across the sectors. Decision made in one sphere affects those in the other. It is also my pleasure to introduce you our link, Learning, Innovating, Networking for Knowledge Access project, which was launched in collaboration with the Reproductive Health Research Division of WHO in 2013. It was presented by WHEC in a side event during the 2018 HLPF forum. It was very well received by the audience. It encourages national health and educational systems to contribute towards continued education at all levels to improve maternal and child health, culturally appropriate contraception counseling information and availability, prevention of teen pregnancies, and child marriages and violence against women and children. WHEC supports capacity building for e-health and e-government applications worldwide. We look forward to developing the use of norms and standards with the World Health Organization. Programs identified by United Nations Development Program, UNDP, least developed countries to disseminate reproductive health research and evidence-based information are provided free by Women's Health and Education Center. Its acronym is WHEC. All over the world, in every country, we all provide healthcare services and other services to culturally diverse population. By interacting with different cultures, we will learn to respect diversity. Building the capacity to care is a global responsibility. And it is our generation's responsibility and our opportunity. We believe on this path, effort never goes to waste and there is no failure. Thank you for joining us. Join us to improve programs in education and health. We thank you for attending. Now it's indeed my pleasure and privilege to give the floor to Dr. Donna Jenny. She has practiced in Springfield education services for the last 30 years. She's an excellent writer and editor and has published many articles. Go ahead, Donna. Take it from here.
Thank you so much, everyone. Good day. And thank you, Dr. Luthra, for your really bright insights and comments about the need for education and school-centered learning to provide the information that we need around the world to make sure that everybody is getting the same information at the same time and in the same way. That's really key to improving the life of women and children in the world today. But today, I'm really hoping to share some of the great initiatives for mental health programs in schools and communities in the state of Massachusetts, and especially in the city of Springfield, for the prevention of gun violence during the time of COVID. And to think that other communities, other worlds, other countries will be able to use some of these strategies to improve their mental health programs in school for the prevention of gun violence. Over the last 10 years, the United States has witnessed a striking increase in school shootings. Most legislation addressing the issue has been focused primarily on gun control. However, it is important to note that the school shooting crisis is a multifaceted problem that will not be resolved by gun regulations alone. Research is clear that social emotional learning programs beginning in preschool and continuing through grade 12 should address the underlying issues that drive individuals to gun violence. These programs will provide students with the skills necessary to address aggressive behaviors, as well as increase overall student well-being and academic achievement, according to research. In 2022, COVID-19, Omicron, and gun violence are also linked by their dual contribution to a growing burden of trauma, contributing to further violence and presenting an urgent public health problem. When asked about PTSD, post-traumatic stress disorder, reactions to COVID-19, 26% of students in Massachusetts reported experiencing 3 or more reactions in the previous month. This data was obtained from the Massachusetts Department of Public Health on their gun violence prevention programs. Positive youth development, PYD, is based on the idea that young people develop through connections with caring adults who understand the development process of adolescents and children and never give up on them. PYD programs promote self-efficacy, positive self-concept, and hope for the future. There are many funded programs in Massachusetts, including core concepts. And according to the Massachusetts Department of Public Health, in 2018, Massachusetts was, interestingly enough, one of the states with the lowest gun violence problems in the country. Our commissioner of the police department in Springfield, Commissioner Cheryl Clapprood, has graciously agreed to give some details to flesh out and give you more information about the strategies employed by the Springfield Police Department to prevent gun violence in the state of Massachusetts and using school intervention programs to further that goal. As a society, she says, the Springfield Police Department entered into a contract in 2019 with Behavioral Health Network called BHN. The agreement allowed for a clinician from BHN to have a police radio of their own and respond to calls with the police department when mental health calls come into the police department. It also allows for clinicians to call for a cruiser to respond to their calls if they self-dispatch. She said that we currently have 6 clinicians and they operate in 2 different shifts, the day shift and the evening shift. When a call comes in for a person in a mental health crisis, the clinician is dispatched with the cruiser for a joint response. This working arrangement has been well received by the officers and the clinicians alike. The officers went from being skeptical about having a clinician with them to being upset when one is not available for an assist. In 2021 alone, there were 1,927 calls for police service, which included an attached BHN clinician. BHN made more than 800 contacts during those calls. Reviewing calls for mental health issues during 2021, on only 1/4 of the calls was a clinician not needed. It was about the same amount of calls that an officer was relieved by the clinician to go back into service. For more than half the calls, both the clinician and the officers were needed to successfully complete the call. Between COVID-19, the lack of in-person services, a rise in drug abuse, tensions in society, mental health calls have risen over 30% for police. Police are dispatched to an irritated, violent, or distraught person causing the disturbance or assault. And we never know in advance, Commissioner Clapprood said, if the call is a mental health call, if it's a drug overdose call, a call involving alcohol intoxication, or just anger or rage. Officers now more than ever are asked to be proficient in emergency medical assessment, knowledgeable in mental health in crisis situations, proficient in de-escalation techniques, proficient in marital counseling, child counseling, all the while being cool, calm, and professional. The demands are greater than ever, as are the expectations of our police officers. Along with all of that, police sentiment hit an all-time low the past 2 years, and recruitment and detainment are difficult at best. According to what I have read and heard in the social media, that is a problem not just in Springfield, as Commissioner Clapprood said, but across the country in general. Communities and states are having a very, very difficult time recruiting and not losing police officers who find a different line of work less stressful. Mental health calls are extremely challenging for law enforcement. We need to stop and prevent violent behavior while gaining the space and time for evaluating the reasons why the behavior is happening. Having the clinician on the calls with us has proven very successful. Sometimes the clinician is able to identify the person involved and obtain a history immediately on their laptop, which informs us, the police department, on the conditions and prior history of the individual. At first response, mental health and crisis calls are similar to drug-induced individuals, especially hallucinogens and PCP, which we see a lot of. It also takes time to recognize if the individual is not able to control anger or emotions and is a fit of rage. I have sent several officers, Commissioner Claffey has said, to a crisis intervention training, and it has proven very beneficial. Training takes a week, and the problems are not having officers who want to attend, but rather having enough staffing to be able to be free enough to send officers for a week and keep them away from their duties. The officers who respond to calls with the clinicians are learning from them while answering the calls. The working relationship has been very beneficial for both sides. We have experienced a high volume of mental health calls in our middle and in our high schools. This past year, we have seen an increase from 1 call for a student in crisis a week to 10 days per school, up to about 2 to 3 crisis calls per week for each middle and high school. Student resource officers can assist by calling up for a BHN clinician or ambulance if needed. Most of the immediate care is provided by school mental health resources. The issues we are faced with is a lack of treatment facilities or beds for these young people. We have 2 major hospitals in the Springfield, Massachusetts area, Mercy Medical Center and Bay State Health Systems. Both are usually full in their children and adolescents' mental health treatment programs. Parents are usually advised to make appointments for follow-up counseling appointments if the behavior is not considered life-threatening or aggressive. Officers assist, but we are also limited on resources that are available. Officers are frustrated when it comes to holding or placing individuals who display mental health issues, drug addiction, or alcohol addiction issues. Years ago, we had an alcohol addiction placement program, a drug addiction treatment program, and hospitals with beds available for mental health treatment at a moment's notice and whenever the need arises. None of these are available to us now in a time where society is facing an increase in all 3 areas. Conclusion from the above information: as a society, we have to do better with mental health. Education, as Dr. Luther has said earlier, is the key. Helping students and supporting them in their quest to make their lives better helps to improve communities too. It's really that simple. It's the funding across every single state in the United States that's difficult. And thank you for your attention and for your role in really improving this very important need in our society.
Thank you, Donna, for touching this very important subject and topic, preventing gun violence in our schools, which is an epidemic in United States of America for sure. And I'm glad your friends are doing a fantastic job in preventing it. Do you have any future prevention programs active with the schools in Springfield?
Yes, we do have many, as we say in America, many irons in the fire. Many programs are being developed, and there are many funding options being explored to make sure that this dream of helping our people comes true sooner rather than later. Because if all you have to do is pick up the newspaper or listen to social media or the news in general in the country and know that gun violence in the schools is at an all-time high, and it's frightening to families and to individuals, and it's frightening to the schools because we need resources to prevent gun violence, and that involves money.
Thank you. Thank you for sharing your thoughts. I think I will stop the recording, but stay on the screen for a minute